Good morning, everyone. I'm Robin Shapiro. I'm the board chair of Health Advocate X. We're welcoming you to our webinar, Avoiding Medical Bill Disasters with Adria Gross. She's the founder and CEO of MedWise Insurance Advocacy. And we're going to hear her extraordinary life story, which led her to doing this work, and also have a really interesting hour of information and tips. This is a webinar format, so if you could please hold your questions until the end. Adria's presentation will be about 50 minutes, and then we'll take your questions either through the Q&A function, or you may raise your hand or put your questions in the chat. And with that, I'd like to turn it over to Adria. Welcome.
Thank you so much, Rob, and thank you for having me today, and thank you for the wonderful introduction. But before we start to talk about today's topic, avoiding medical bill disasters, I'll let you know a little about myself and why I'm so happy to be here. So here's a picture of me at my bat mitzvah. I'm originally from Port Jervis, New York, and I was crying. And the reason why I was crying here, the reason why I was crying, here I am 13 years old, but I was very happy to just be alive. I'm originally from Port Jervis, New York. This was a picture of my synagogue. And here I am at 11 and a half years old in that synagogue. And we had a test. The name of it was Temple Bethel, and you can see that up on top. And I told the rabbi, our teacher, we have a map of Israel, how to write down the cities. And I said to him, I'm really not feeling well. So he allows me to go down the hall. I sat outside his office. And as soon as I sat down, I went into a coma. And when I woke up almost 10 hours later, I saw a cross on the wall. And I'm laying there straight ahead, opening up my eyes, looking straight ahead. I see a cross on the wall. And I'm thinking to myself, am I in heaven? But at the time it was called St. Francis Hospital, was then Mercy. And then you might have heard of Bon Secours. I know Bon Secours throughout the United States. Now it's Bon Secours. But I'm laying in the bed. I look straight ahead. I see a cross on the wall, thinking I'm in heaven. But to the right was my parents. The right was the rabbi. To the left was my parents. And I'm thinking to myself, holy cow, I cannot believe that I'm alive. And here I'm laying in bed. And that was the beginning. I had encephalitis. I took them, my doctor thought I did. He then sent me from little Port Jervis, where Pennsylvania, New York, New Jersey come together. He sent me to New York University Hospital. And within a week after that, at first they thought I had a brain tumor. My mom was crying her eyes out, thinking I was going to die. But I had a bite from an insect bite. And when an insect bites a horse carrying encephalitis, and the insect bites you, that's the cause of encephalitis. So I had encephalitis. Let me tell you, the life that I had was very, very difficult. I used to average 18 seizures a month. At one point, I was on 32 pills a day. The longest time that I ever went without a seizure was 3 months. It could have been diet or no stress. Seizures normally happen to people when they're under stress. It can have to do with menstrual issues. It can happen, insufficient sleep. Even if you're doing any type of drugs or alcohol, sometimes they even say, oh, marijuana is great for seizures. Well, it would cause, I have to be honest, I did smoke at one point and it caused seizures. So, but here I lived with this condition for 25 years, almost 25 years of my life. And finally, I was able to have brain surgery. I had a left temporal lobectomy about 33, 34 years ago. And I have been blessed many times over. So after this personal experience that I went through, I then, I wound up coming through the back door of one of the major insurance companies. And before I forget to tell you this later, I really have been surprised at myself that I have a very good relationship with most of the executive offices of the insurance companies now. And I think that the fact that here I worked for one for 2 years and I worked for another one for 10 years, after I had the brain surgery, I think that that really helped me to totally understand what goes on. And even after that, I then adopted 2 kids from Vietnam, took off 4 years, keeping my feet wet in the industry. But then I worked for another insurance company, worked for one for 2 years, another one for 10 years. And I opened up a medical billing business. I said to my doctor, I said, hey, listen, I know I was on the other side paying the claims. And each one of those insurance companies within 2 weeks taught me how to deny. So I thought to myself, all right, I was on that side. I'm going back to work. I opened up a medical billing business, but now I didn't open up that business till I started working for this podiatrist who was my doctor. And I would work for nothing just to learn the business. But he said, I want to hire you and I want to pay you. And so I worked for him. After I worked for him for about 2 to 3 years, then I opened up the medical billing business. And I have to tell you, boy, I've learned so much. And then 11 years ago, I opened up the advocacy business because I saw that people were getting all these denials. And I used to be on the other side making the denials. They taught me how to do it. They told me what to look for. And I have to tell you, I also help write policies. So I understand policies very well, what you're covered for, what you're not covered for. And then the other thing that happened is after denying claims and the calls that would come into the insurance companies, I learned, not always, but very frequently, how to twist their arm to get things done the right way. So I feel very blessed that I helped write the policies and I had the experience. So when I was writing this, I thought to myself, I was trying to prepare for today. And I thought about, I've twice since I opened up this business, I've been asked to speak before insurance companies. One, they flew me down to Florida. The other one took place in New York City. And I spoke before the insurance companies. And when I went to Florida, this happened about like 7 years ago, they flew me down in the Orlando area. And here I'm standing in front of all these insurance companies. And I thought about what happened to me after I had the brain surgery. My doctor got paid, but I had like this copay or deductible. And he sends me a bill for $278. So now I have insurance, and I went back to see him after I started working for the insurance company for follow-up visits and da-da-da-da-da. But anyhow, I got a copay of $278, and I'm working for the insurance company. So I said to him, I said, look, I said, I got a bill for $278. And I had just started working for the company. My first experience in the insurance industry, like not in the insurance industry, but working for an insurance company. And I said to him, I thought I was covered. I'm covered by your company. I have insurance for you. Why am I getting a bill for $278? So they said to me, okay. We'll take a look at it again and we'll see what we can do. And what did they do? They paid like, I think another $78 or $81, and I was still responsible for the difference. So when I was in Florida speaking before this group, I turned to the people and I said, listen, you get a bill for $25,000. This is your copay or deductible, or it was an out-of-network provider. You get a bill for $100,000. You get a bill for $250,000. You get a bill for $500,000, because I've had cases like that just for balanced billing. And I said to him, I said, how's that going to make you feel? And I got to tell you, they work for the insurance companies. They couldn't answer that question. So these are the thoughts that I always have in my mind about what's going on in the industry and what we're up against. So this is a little cartoon. I'm sorry, but stress caused by trying to figure it out on your insurance, health insurance is not covered by it. So when discussing this before health insurance executives, you know, my question to them, and I hate to say this, is like, and I was on that other side, you know, this is what people think of you, and how does that make you feel? And you'll never get an answer from them. So you really need to know your rights. You know, like I said to you, I was helping, you know, write policies. You need to know when you look at that policy that you get, and I highly recommend this whenever you're having issues with your bills, look at your policy. What are you covered for? What are you not covered for? You need to be aware of this before you start fighting. Now, I have a case right now, which I'm working on. And really what happens is when you look at your policies, the primary that all the commercial insurers follow suit on is Medicare. So you have to look, you know, here's someone who's trying to get a peripheral nerve stimulator. And I've had cases like that already where I dealt with attorneys. I do a lot of work with attorneys, but here's a case where this guy, he needs one, a peripheral nerve stimulator, and his commercial insurer is saying, hey, we're not going to cover this. But the issue is this: when Medicare usually covers it, and Medicare does cover for this, they usually follow, the commercial insurers usually follow suit. So this is just one example, which they're telling him, hey, you have no other options. So I am going right to the executive office. I'm sending a letter to them. In fact, my client lives not too far from the executive office. They're going to drop the letter off to the CEO, and I'm going to follow up with the insurance company and talk to them, because I think that this is a really bad situation, because they need to look at complications. You know, like sometimes they don't want to do surgeries and they want to give you medication, but if that medication is not working and now they don't want to pay it, they need to think about the complications that can happen and even how much it's going to cost them in the future. These are really important things to think about. So, don't you love a bargain? Compare prices for tests. Check the hospital prices. Check your medical provider's prices. What was the doctor's grade for my disease? The best thing that I recommend you look at is Castle and Connolly. Castle and Connolly, they throughout the United States, when you look at magazines for your area, let's say it's New York or Dallas or wherever you are, they usually have a magazine for your location. And once a year in their publications, you'll see a listing of the best doctors in your area. And they get that information from Castle and Connolly. You can go on to Castle and Connolly, you know, Consumer Reports, the Vitals, the Health Grades, WebMD. And I'm telling you this because you really want to see if you can find out information on these people. How many procedures do they do a year? What have been the outcomes of the procedures? Even before I had brain surgery, I went to, I had left temporal lobectomy. I went to other people who had used the same surgeon. And I asked them, I said, you know, how are you making out? What's going on? You had the surgery, who was a doctor, blah, blah, blah. And they share that with me, which I'm very grateful for. And you might, before you follow up and decide to go for surgery, these are things that I would highly recommend you look into to try and make sure that you're going to be well taken care of. The other thing that I tell people is if you happen to know a malpractice attorney, I would recommend you reach out to them and see if they know anything about the doctors in your area and what their thoughts are about them, because they're the ones who handle the cases, you know, when these doctors are being sued or the hospital's being sued. And things are getting worse on that. And the reason why they're getting worse is because the insurance companies are not paying out what they used to. And when someone goes to medical school and they're paying at least $250,000 to go to medical school, and they need to pay back these expenses, Well, let me tell you, boy, a lot of times they're not making enough money to pay the expenses. And I know doctors out there right now, they're opening up other businesses because they're not making enough money to pay those expenses. So you really, it's a scary road we're on right now for that reason, because I don't think we're going to get the care that we need, and you have to be really careful on who you're going to go to and make sure if you can. I mean, look, if it's an emergency, you really don't have a choice. But if you have time to investigate these doctors, I highly recommend it. So a lot of people, I've had situations where people call me up and they're looking for this bargain. They're thinking, oh my God, I have to have this surgery, whether it's a facelift or even dental work. A lot of people go overseas for this. And I had a guy call me recently where he had a situation. He says, Adria, I really need the surgery. I know it's done overseas and I'm thinking about going there. And then he says to me, he says, do you think that my insurance company is going to cover it? And I said to him, listen, I know how you feel. I understand where you're coming from. I get it that you want to go to Europe. I get the whole thing. But the question is this: call your insurance company and ask them, hey, I'm going to get the surgery over there. Number one, will you pay for it? Which in most cases they will not. I've heard of rare cases where they will. But even if they're not going to cover it and you come back here and you have complications, are they going to cover you for those complications? These are things that you really need to think about to see where you're heading before you take that next step and have the procedures done overseas. So this is some information that you want to think about. These are areas that you can go to try and get some more information on this. And you can call them to find out about the providers that are overseas to see, what their credentials are, what their experience is. I mean, they might be able to help you on this. I'm not guaranteeing it, but just an idea for you. So this is another little cartoon. Ask the right questions. Is this test required? Why is this test required? And to save money. So first we're going to run some tests to help you pay off the machine. And when people receive a bill like this, they feel like they're being cheated. Like just today, a guy called me last night from California, and he sent me a list of the procedure codes, and I saw how much his insurance company paid out. And he has small copays, but I said to him, hey, look, let me see what the normal payment on this is. And maybe you can use that to negotiate. I'm giving it to him for free because it's not much money. And I don't want him to have to pay me for something that he's going to lose money on. I will not go that route. So anyhow, we're going to talk about it, and I'm going to, give him the best advice that I can on it. But, you have to really watch out on how much they're charging you on some of these bills, because I've had situations where just for an MRI, they could be charging like I've seen $18,000 for an MRI. I mean, I know what normally gets paid on those. And these are things you need to look at. Now, a lot of times you're going to see where say, look at healthcare blue book, or they're going to give you other areas to look at. But I'm going to just share one thing with you right now. The truth of the matter is, everybody, when you have insurance through a company and they're covered on your plan, the providers usually never get paid more than 160% of the Medicare rates. Now, when you go into these other places like the Blue Book Healthcare and there's other ones, I swear to God, I swear that it comes from the providers and not the insurance companies, because they want to get more money. The bottom line is, when you look at the Medicare rates, which you can look at state by state, and by the way, they might be a little bit here, a little less there. It goes by location, but there's not that much of a variance. Just remember that. And that's really where you find the true amounts of what you should be charged for the procedure codes. Next slide. So this is, when you go to a provider, some of these policies, even on Medicare policies, they need pre-approval. You have to get referrals sometimes on these policies. You can't even go out of state, and you have to go to your primary doctor and say, okay, I need a referral for this. And I mean, I saw it happening with the commercial insurers before you turn 65, but even on some of these Advantage plans, they're asking for that. And, the one thing you need to find out all the time is, and especially if it's a planned procedure, are you covered? Do you have a policy with the insurance company? A lot of the doctors don't know. And the only people who do know are their billing companies. It's crazy out there, but you're going to see this happening. So what you really want, I highly recommend you get something in writing. Send me an email, send me something in writing, because I don't want to have to pay more money if you're out of network. Now, we're going to go over the new law that started this year on January 1st of 2022. We'll talk about it, but there's still complications out there involving this, so we'll get more into that.
And Adria, we did have a question about how to look up the Medicare rate.
Just go into Medicare for your location and say you're looking for the Medicare rates, and it's going to, listen, they even changed their websites. So you have to do a little fishing around, but you will find it and you will see it. And they even have, there's one, and I can't give you an address because they always change it. I will never give an address because I haven't looked at it recently. But the thing is that if you do enough research, you can find a listing for Medicare rates in every single state for each procedure code. And it's a big, wide Excel sheet, but it's out there. You have to look for it. I mean, look, if you have problems and I have some free time, call me on the weekends. I'll help you search for it. But it's really important that you look at that, because those are the rates. And what's happening now, there are doctors out there who don't even want to take on patients because they know that they're not going to get paid enough. So they got to be some of them are selected. There's a hospital in New York City where if they'll cover you, but only 50% of their doctors take any health insurance at all. So these are things you really have to be aware of. So Costco member pharmacy prescription program, they're one of the lowest ones out there when it comes to medication. But what I am finding now is every time a friend of mine comes or someone calls me up, my brother had an issue recently, look in GoodRx. Take a look there, because when you go into GoodRx, you're going to have to pay out of pocket. But I got to tell you, with GoodRx, you might only be paying like, I mean, I've written articles on it where you might only be paying like $15, but you might have a high deductible on your prescription plan. A lot of times that $15, they might be charging you $45 to $80 for it. So even though you're doing it, you got to think about this. And am I better off if I go through GoodRx and look, because they have a listing on there of pharmacies and how much each pharmacy is going to charge for that medication. So I highly recommend doing that. And Costco, even a lot of the times you'll see Costco listed there about how much Costco is going to charge. Another area I recommend you go to is there were buses, even though they claim it's illegal, there were buses taking people to Canada in the northern states for them to buy medication in Canada, because believe it or not, when you look online and even the Canadian pharmacies, you need a prescription from your doctor, but a lot of times it might be 1/20th of what the cost is here in the United States. So you have to figure out. I mean, I heard this year we don't have the donuts anymore, the donut hole with, for the prescription plans. That's great. But I got to tell you, boy, some of these plans, sometimes you get really great benefits from your employer, and you might even get some great benefits through some of the insurances out there with Medicare. But be aware of it. See how much they're charging. See if you, like if you pay out of pocket, it's going to be a better deal. So, the pharmacy checker, the drugs are imported from all over the world. In fact, I have a cousin who works at one of the major hospitals, and he was publishing a book I found out through him, which I didn't know for sure, because the book is all about generic drugs. And I found out that over 90% of our prescriptions are made in China. I was thinking India, it's China. So keep your eyes open. That's all I can tell you. Be aware, keep your eyes open, because this is scary. This is a scary road. So I'm going to go back to the screen of the CIPA members. It's a full list of the pharmacy companies, the pharmacy places that you can go to in Canada. And all you need to do, like, even if when you go on GoodRx, you put the drug name, you put the dosage in, and it will tell you how much it's going to cost. And you can do the same thing through Canada. Drugs are sold through Canada, and they're supposedly carefully checked. And supposedly it's also illegal to buy drugs from another country, even for your own use. And they only allow 90 days supply. But I have to show you this screen because I had a friend who lived in Tucson, Arizona, and every time I go out to her, I would travel into Nogales. And as I was coming back in, there's a guy there who's checking my bags, and I'm buying all this medication for her, the asthma drugs. And he says, "Show me what you have." And I mean, literally, it's like a trick or treat bag. And I open it up, and he stood there laughing at me. He says, "Go, go," because I'm an honest person. I tell it like it is. So anyhow, here comes another card. Oh no, I took that cartoon out. Okay, I didn't realize that. So 2 midnight, 3 midnight rule. I don't know if anybody knows about it, but I'm going to give you an example of someone who was a senior. I'm going to give you that example. I'm going to give you an example of a friend of mine who I've known for many years, who was in a hospital. And at the time she was only 40 years old and she had an ERISA plan. So this is the issue. And by the way, this came out to a freeze when COVID started, but now they're using the same theory again. So if you, and originally this was with Medicare, but now it's also with commercial insurers. So what happened is, if you go in the hospital, and most people, when they go to the emergency room, they are outpatient under observation. Now, for you to be covered on your insurance, you need 2 midnights as an inpatient. And then if you have to go into a facility afterwards, like a skilled nursing facility or a rehab, you have to have 3 midnights as an inpatient. And a lot of times they say days, but it's really midnights, because they go, with days, it doesn't matter, because sometimes you have bills, like you go into a hospital at, let's say 6 o'clock at night. It goes by midnight. So you got to always check the midnights. But so remember, 3 midnights for a rehab or nursing home, and 2 midnights just to be covered for the hospital for Part A. And inpatient, because you can't be outpatient under observation. But what I want to share with you is this. I had a friend in New York City who was going into the hospital, and I had dinner with him 2 weeks before he went in. And I said to him, "Listen, you got to be an inpatient. You can't be outpatient under observation. Otherwise, you're not going to get into that rehab," because his wife couldn't take care of him at home after the surgery. So he goes in on Thursday, has a surgery on Friday. His wife calls me Friday night and said, "Adria, he's outpatient under observation." God bless her, man. She did a lot of volunteer work for the hospital, and she went right to the CEO. They made him an inpatient, but this has to be done while they're in the hospital, not when they get out, because when they get out and they go into this rehab, you might not be covered for that rehab. So you have to be aware of this information. So that's one story I wanted to tell you. And then my friend, who was in her 40s, she had an ERISA plan. And what was happening is, after Medicare started this, the ERISA plans were starting to adopt the same law as Medicare. So she goes in the hospital, she goes through the emergency room, And I went to visit her and I said, listen, we better be careful to make sure that you're going to be covered. So after she was there for 3 days, they came up with another diagnosis, and she was in that hospital for a week. And in between, she's a brave person like I am. She gets the CEO in there for the hospital, and he says, don't worry, you're going to be fine. You're an inpatient, blah, blah, blah. Well, guess what happened? She goes home, and 2 weeks later, she gets a bill for $40,000. So I told her what to do, and it worked. But you have to be aware of this. And your clients who you're dealing with, you might want to share this information with them to help them. You know, if this happens to them, you need to be aware of this. So yes, that's my surgeon, the one who cuts himself shaving. You're not the only person that might think that, you know, this is, you know, hey, this is really a joke, right? But think about this. You think about this submission of claims and all these denials. I mean, it's out there. I mean, things are happening. And, you know, they associate the doctor with the insurance company. You really have to be sure that this doctor is going to take your insurance before you go into that hospital. Here's your prescription, sir. Side effects may include bankruptcy. So I used to travel a lot out to Arizona, like I was mentioning before, but a friend of mine out there, she had breast cancer. She had a medication. She was paying $17 a month. And you're still seeing this happening now. They're jacking up those bills for the medication. She wound up having to pay $550 a month rather than $17. Someone else who I know, he worked for the government. He worked for the federal government, and he had to pay. They wouldn't cover her for medication any longer. He paid over $86,000 a month for her medication out of pocket. Okay. Another situation was, this was someone who had schizophrenia, and what they did is, she was taking 2 pills a day. They lowered her to 58 pills a year. That's not enough medication. You have to fight for your rights. It's really important that you fight and discuss this with your doctor, with your insurance company. I mean, this is really important stuff to know. You have to fight, and don't give up. Here's another one. I'm having someone to prep you for the bill. I mean, they overcharge you because they need money to cover. People even say to me, you know, when I come back to them and I say, how can you charge this much money? And the excuse is this: the insurance companies don't pay enough. Medicare doesn't pay enough. So what we do is we go after the patients who don't have insurance, or we go, you know, and that's how they try and get the money to pay for their expenses. But keep in mind, the head honchos at the hospitals, how much are they getting paid? Even the insurance companies, it's the same thing, you know? Okay. So can we see only an HMO on my plan? And I'm beginning to wonder about the doctors in my HMO. The last time I saw one, he put a cone in my neck and told me not to lick myself. I guess I've been lucky. My entire family's been pretty healthy for the last few years. And listen, we have a high deductible, but are you going to reach that deductible? What's going on there? Knock, knock, who's there? Hippo, hippo, who? Sorry, I can't tell you that. I had a situation where I got a phone call from a county, and they said, Adria, this woman died. She went in the hospital and she died. And we don't have information, and we need to get information, blah, blah, blah. I said, listen, even if she didn't fill out that HIPAA form because she was unconscious when she came to the hospital, you have to give it up. You have no choice. And other ways to get the information they need. And then they said, okay. So I'm going to talk to you about who processed your claim, but I want to tell you this one. And I've written articles on this. You know, when you're buying insurance, you have to think to yourself, what am I getting myself into? What kind of insurance is this? And you have to be very careful. You do not want to get involved in religious sharing plans, associated health plans, or short-term policies. Again, it's religious sharing plans, associated health plans, and short-term policies, because I can guarantee you almost on every single one of those policies, you're going to have a pre-existing condition. And you have to read those pre-existing conditions thoroughly. I had a woman coming to me. She was 64 years old. Rather than paying, $2,000 a month and maybe even $750 a month, whatever the fee was for her insurance, she says, I don't want to pay this anymore. So she goes shopping online and she finds this religious sharing plan. She had cancer 17 years before that. On that policy, it said 24 months pre-existing. But guess what? She had cancer 17 years before that. They still denied it. And it was a different type of cancer. They wouldn't pay for it. And to try and get somebody online to talk to them, it was impossible. And you know what? I went to Department of Insurance Attorney General in Florida. They sent me to Georgia where the company was. She lives in New York State. I went to New York State. So I went to Department of Insurance Attorney General in 3 states. I even went to Congress people. The fact that this was not filed with the Department of Insurance in the state, they don't care. And you're stuck with those bills.
Adria, could you repeat what you said about the plans for pre-existing policies?
Okay, there are policies out there, especially I see it more so in the lower premiums, where they hardly charge anything. Oh, I got this great deal. You're going to see commercials on TV for this. You have to investigate it. You have to take a good look at it. And I even recommend going on to Better Bureau before you buy it, because of the complaints out there where they're not paying out. This is a big issue. Be aware of what you're signing up for and what has happened with those plans. Be aware of this, because you might get screwed in the long run. I mean, look, for the pre-existing conditions, let's say you had a cold last year, right? And it was covered. You had to go to the doctor, like you had sinusitis. Well, on a pre-existing condition, you had sinusitis last year. We're not going to cover you for it this year. I mean, look at that. This is insanity. This is craziness. So you have to really be aware. So who processes your medical bill? The medical provider, the hospital, the doctor, the lab company, or an outside medical billing company hired by your medical provider. And you're going to see this a lot. You're going to see where you go back to the doctor and it went through this outside company, and it's murder, absolute murder to get assistance. Because let me tell you something, some states will not allow this, but they still do it in certain states where they get paid on a percentage basis. Whatever the doctors get paid, they get a percentage of that. And again, it's illegal in specific states, but they still do it. And the states don't go after them. But that's a big issue with these outside billing companies. For those of you who don't know, the New York State Surprise Bill law became effective April 1st, 2015. And this was only for emergency charges. And there were issues like my friend who had that ERISA plan, and she worked for a major company. This was an emergency. She went through them, but they were still and this law is already in effect, and they went after her for the money. You have to fight for your rights. And you have to really look at these laws to see what you're covered for and what you're not covered for. So we're going to go back to that subject, but what I was talking about before with the billing, and I should have had this after that section. I'm sorry that we went back to this. You have to really watch on those medical bills, a lot, especially on the tertiary bills. When it goes to an outside billing company, they don't even want to send the bill out. They don't want to do anything, and then you're stuck with it. So you really have to look, and I'm going to talk about this again later before we're done. You have to look at what those original bills were and how much you were covered for them and whether or not they were processed correctly. A lot of the times they hire people, hospitals are hiring companies overseas to process their claims, and they don't know what the heck they're looking at. So you really, when you have problems with these outside billing companies and you're not getting the treated the right way, you have to go back to the medical provider and tell them what's going on and ask for help. And in most cases, they will. So, and there's also pre-authorization errors. There's a lot of issues that come up. But let me just go back to this other screen. So this thing about involving the New York State surprise bill, there were other states that adopted it, and many states did not, but there were still issues going on. So what happened, just starting this past January, we had the No Surprise Act. And with the No Surprise Act, it started January 1st, 2022. It started this month. And what's happening there is with the FEHB, that stands for Federal Employees Health Benefits. So a lot of the cases that would come to me, they couldn't do anything, even though we had New York State as the first one for the No Surprise bill. And then you had other states that followed suit. There must have been about half of the states, but you still have people who were working for companies, very large corporations who were ERISA, self-funded, self-insured, the ERISA plans, which is that FEHB, which stands for Federal Employees Health Benefits, okay, which is, I would say about 30 to 40% of the employers in the United States. I mean, like I found out through Chamber of Commerce, I belong to some Chamber of Commerce, how many people are single companies, solos, where they don't have other people, but these large corporations is where these issues came from. And now this law is saying, okay, you have an emergency, you go in the hospital, no matter who you are, you got to be covered. And the law, you have to read the law. It's only almost 500 pages. I'll get a little bit more onto that, but it pertains to the emergency and non-emergency cases. It includes the non-participating air ambulance, but you still can be billed for whatever they feel like for on-ground ambulances, okay, where the air ambulances, there's going to be limitations, okay, and then you've got issues with the out-of-state rates and the new laws with cost-sharing amounts on how much they can really charge you. And then this independent dispute resolution, I've dealt with that many times already, because when I go to the state, when I go to the Department of Insurance or the Attorney General, and now you might have submitted your claim 3 times for appeals to the insurance companies, and then you go to the state. Then after that, when the state gives up already, then they go to these independent dispute resolution organizations. And again, I've always wondered in my head, who runs those organizations? I don't know, because I question that very often. But what's happening right now is the bill is about 500 pages. And when you go in the hospital, you go to the doctor, you go to the hospital, especially more so in emergency room services, which sometimes they're not even owned by the hospital, and they have an outside billing company who bills just for the emergency room. But the issue is this: when you go into a hospital and you're sick as a dog, you might not even be unconscious, but you're so sick, how in God's name do you understand what is written on that agreement that you're signing, which very often could be 20 pages. But what I found out from one of the doctors is, and I don't know what the wording is, and they could differ from hospital to hospital or doctor to doctor, there's a wording in there that they're putting in, allowing them to balance bill you. Not saying that they're all doing it, but it is happening. And I'm telling you this because I want you to be aware of it. And if you, like, I just spoke to someone last week and they said, Adria, I wouldn't sign those papers. And they did take her in and they did take care of her. Okay. But just be aware of this, because even though they're not allowed to balance bill you right now, you might be signing papers where you are giving them the permission to do that. So be aware of it. Let's see. What kind of doctor do I see for an enlarged medical bill? Another one of these little jokes. So this is something that I was talking to Robin about before we started. And I'm going to talk to you about these laws, and I'm also going to talk to you about, and you have to think about this also with the religious sharing plans, the associated health plans, and the short-term policies. Sometimes there are people out there who might have two policies. I had a case recently, which I'm still working on. It's now been in the hands of the Attorney General and Department of Insurance. Department of Insurance really threw me all over the place, to the point that when they sent me to Department of Health, it went from Department of Insurance to another department. I can't think of it right now. And then they sent me to the state for Department of Health. A lot of times they don't even want to go near these cases. Now, I know that the Attorney General is going to work on a case, and I've had other cases where in the hands of the Attorney General and me fighting with the Attorney General and also the insurance company, they've come around on cases. I have a case right now that I'm working on where I think I might have to go to the Attorney General's office unless this is the case that I mentioned earlier, if the insurance company is not going to pay it, because this guy has no other avenues to take. So when you're enrolling in health insurance, there's three things I always recommend. Who are the providers on the plan? Are those providers part of your insurance companies? You really need to look into this. What hospitals are on the plan? Are the hospitals covered? What are the medications you take? Are they covered on the plan? What will the charges be? And, these are three questions that I highly recommend that are annual guidelines when deciding on health and when you're making decisions on your health insurance. The things that you really need to think about to help determine this is, what are the deductibles? How much is the premium? What are the copays? What's your maximum out-of-network coverage? What's your maximum in-network coverage? And you have to really look at these things. You have to be aware of this about, what your charges might be. So, and then sometimes, like this case I'm telling you about, which is now in the hands, I went back to the insurance company with it through the Attorney General's office. The guy had two policies. And when I went to this skilled nursing facility, they didn't want to send out the medical records. I fought for 2 months. And I finally said, you know what? I'm done with this. I'm going to the state, and I reported to the state. And they might have investigations for this nursing facility because they're not doing what has been asked of them, even by the insurance company. They wouldn't follow up and do the right thing. So, and I just want to tell you a couple other things. If you ever need transportation to and from a hospital, the only way you're covered is if you go through a regular ambulance, not any other type of service out there, unless you're on Medicaid. And I'm going to be speaking next month about telemedicine. If they're saying to you, oh, we're offering you telemedicine, first of all, it has to be on video. And secondly, you really need to call your insurance carrier to see whether they're still going to cover you for telemedicine, because some of the insurance companies are not covering any longer. It might even go according to your policy. You really need to call to see whether or not you're going to be covered for telemedicine. So these are recommendations about what to do before, during, and after being in a hospital. If your hospitalization is not an emergency, check out your insurance policy to interpret your coverages. Take a good look at the coverages and exclusions on your policy. Call the hospital's billing department and ask them what the room charges are, and not what they, what they just cover. Like, there are people like, they'll charge you for tissues, or a toothbrush. I mean, be aware of what it's going to be. And I also recommend, keep logs of your services. If you can have someone there, I was just lecturing yesterday. If you can have someone there, 24 hours, not one individual, but multiple people, friends, relatives, about who comes in and who goes out. But sometimes people question what those bills are because they may be billed for services that were never even really rendered. So that's something you want, you really should, take care of it and try and keep in mind if you can. Keep your EOBs. People say to me, they see the EOB, they say, oh, I have to pay what's not paid for here. No. See what the hospital's going to charge you. Don't go according to what the EOB is. Look at those bills carefully, and see what bills you get after the EOBs. And if there's such confusion on this, call the billing department. Again, like I said to you, a lot of times they're outside billing companies. You might want to go directly to your doctor's office if there's confusion on here and you're really getting nowheres with the outside billing company. Here's a list of cases that I've worked on. I can't believe, that one for $1,000 next to the bottom. That was a case where the hospital would not take her insurance. She got insurance through the state. And believe it or not, the sad thing was I did get help from the Attorney General's office. But in that case, she died 3 weeks before the payout came, which was over $1 million. It was just disgusting. This is one of the issues that Robin and I spoke about. In fact, she sent me a couple articles. I mean, a lot of times, if you're a minority, there are situations that they might run into medical debt. And a lot of times, sometimes it's a language barrier. You speak another language, they don't understand, you don't understand. And that causes really severe issues. There are places throughout the United States where a lot of immigrants go to because they don't have health insurance, and they get help, they get services for free. So if you ever come across anybody in this situation, take a look in your area to see if there are services that they can get that are not going to be a fee. These are the 2 books that I publish. Even when I've lectured at libraries, I just donate. If anybody buys the book, I just donate the money to the library. But Ralph Nader endorsed it. He won international edition. So I just want to show you that. And, the buck stops here. You really have to be out there, trying to help people. And pretty much this is a summary of what we discussed, tying it together. Empower yourself, know your rights. And, people always think just love a bargain. I mean, there was an article I was in the Wall Street Journal. It came out October 4th of last year. And it was about hospitals where they're charging even three times or more to patients. I mean, if you have time to look, discuss fees before you go in, and whatever that fee is, get it in writing, because a lot of times people are quoted amounts and then they walk out and they get the bills and it could be thousands of dollars more that they're being charged. So get this in writing, please, I beg you. Ask the right questions. Check options for the medically uninsured and underinsured. And, if you have to, call your Department of Insurance for your state. Look for discounts on your medication. Don't assume your bills are correct. Check to see if you're overcharged. You can go ahead, like I said to you before, is go into the Medicare rates, because you might be able to negotiate those bills when you're getting this high balance billing, or it could even just be your deductible or copay. And let's say you feel uncomfortable. I can't afford this. I'm having financial problems. Take a look at that.
Well, and often, and we know this, I'm just going to jump in here, that sometimes just asking the question about, can you take it off the bill? Sometimes they'll do that, especially if you're in the hospital and they're charging exorbitant amounts for things like lotion and a toothbrush and things like that. A lot of times they'll just take it off the bill.
Right. So you really have to try and figure out exactly what you're being charged for. Another thing I didn't mention to you is you'll see miscellaneous, MISC. Call the hospital. What's that miscellaneous for? A lot of times what Robin was just saying is exactly what it involves. So learn how to decode your bill, make sure that they charge you reasonable and customary charges, take action to decrease your bill. And please, I beg you, fight and never give up. Never, ever, ever, because that's what I was on the other side denying. Try to not allow them to take advantage of you, please. And thank you, Robin, for having me speak today.
Well, we are so honored to have you join us, Adrian. That was really great. We have a bunch of questions here. So, and somebody also asked if this will be recorded. It will be recorded and available on demand. So if you want to listen to it again or refer your peers, or it will be available on YouTube, available to the public as well. So let's go ahead and we'll take the questions in order here. I had an insurance company in 2009 who was slow to process claims, still getting EOBs from them from 2019, so 3 years ago. They tell me they have only one person processing claims. They are very far behind. What action can I take against the insurance company for failure to process claims in a timely manner? I've been sent to collections by medical offices who are not getting paid for services that should be covered.
Okay, listen, I'm really sorry about collections. And what I do when I'm helping people is I try and put a stop to the collections, and I go back to the doctor and say, look, you know what? I was sent into collections because the insurance company's not paying. But if that insurance company's not paying, I'm telling you right now, I want you to get on the phone and I want you to call. Sometimes they won't take calls and you might have to send, letters in. Yeah, but very often they want it online. I'm telling you, I would reach out to Department of Insurance and the Attorney General for your state.
Yeah.
This is awful. And now that you have collections after you, that's a disgrace.
But like in Washington, Office of the Insurance Commissioner, that would be a likely place to refer them to, and the Better Business Bureau actually probably.
Well, Better Business Bureau, it might help them, but not as much. Not Better Business isn't as much as the Department of Insurance and the Attorney General.
Yeah, good. And I want to just acknowledge and thank Bridget Jablonski for posting the Medicare.gov procedure price lookup link, which is in the Q&A. So you'll see that. Next is Angie Galatas asks, do most Canadian pharmacies take a US order for medications?
It depends whether or not they sell it.
But I mean, if they sell a medication, would they just typically take a US order, or even though that's not legal?
If they don't sell it, you're not going to get it. They're not going to get it because they're not selling it. But listen, there's so many pharmacies out there and there's so much to look at. You have to look at the list. I would Google anything I can to find out the pharmacies up in Canada, because if they don't sell it, they can't sell it to you. And by the way, I didn't say this, Robin, but I had a case where this woman had I think it was I don't know which Hep it was, but she needed treatment, and through her doctor, she was able to get medication. And sometimes you can go directly to the manufacturers where they give you discounts on it. She would have had to pay $86,000 and she only paid a little over $200. And that treatment is a 9-month period, but she was able to do that. So when you can't afford it, call the pharmacy company, the pharmaceutical companies, because a lot of times they'll give you a break, especially when they know you can't afford it.
Absolutely.
Yeah,
absolutely. Beth Barnett was asking, what is an ERISA plan? So you were saying that the ERISA plan is also following the Medicare.
Yeah, that's employee benefits plan. You can look it up, but what it is, the large corporations, they all have ERISA plans, which are self-funded by the company, self-funded, self-insured. So listen, ERISA plans, what happens with ERISA plans, they have an agreement with an insurance company. They hire one of the insurance company to process your claims. They give like maybe $10 million to that insurance company to process the claim, okay? The decision-making is not really the insurance company. The insurance company is just processing the claims for you. The real decision maker is the CEO of that corporation. that you work for or that person works for.
Fantastic. Thank you. That will be our last question. And thank you so much, Adria. This was really fantastic.
Thank you.
And I'm sure that if people have follow-up questions, they can find you. I think you're listed in our directory as a member, I believe.
I don't know, but if not, it's my company is MedWise Insurance Advocacy, and I'm Adria Goldman Gross, and it's pretty easy to find me.